19. You did go out and check the assessment center yesterday to get a test for yourself, and we're still waiting for those results. How are those lineups looking today?
Yes, Janella, it was another busy day right across the city as more people answered the Premier's calls to get tested. We had a chance to speak with a number of directors and doctors at some of these assessment centers to find out how they're dealing with the influx of people and whether those getting tested are at any risk. Doctors and nurses guide a long lineup of people outside of Women's College Hospital. For the past 2 days, there has been a surge in volume at assessment centres across the city after the Premier expanded the testing criteria, promising no one would be turned away.
We've been anticipating that there would be an influx of people for a little while.
Christine Bruce is the Administrative Director of Microbiology for Sinai Health. Their labs are capable of doing 10,000 tests a day. That's the most in the province. But they've never had to use their full capacity, at least not yet. Their highest day so far has been 6,000.
However, we are seeing a lot of trends of high volumes coming in, particularly with the announcement over the weekend. So it shouldn't be long before we are at that point, and we're prepared for it.
Prepared, but ramping up abruptly to maximum capacity does present its own challenges.
I think it's a bit of a shocker for the human resources because you get to a certain cadence in your workflow where you expect that you're going to do so many in a day, you get a bit of a rhythm going, and then all of a sudden there's this surge of volume that comes in that you weren't prepared for.
In Peel, William Osler Health System saw the most people it has seen since the start of the pandemic, testing 800 people yesterday. Their drive-through testing centre in Etobicoke is their most popular assessment centre.
Prior to the forward announcement, the wait times were a little bit shorter, and now the wait times are getting a little bit longer. And I think that can be sometimes frustrating for the patient that's waiting in line there.
They've implemented a ticketing system so that patients can return at an allotted time, some even being asked to return the following day. The province has consistently missed its testing targets with the capacity to do 20,000 a day. Not once has it actually met that goal. One of the major deterrents for people is exposure to the virus and whether or not people are putting themselves at risk by going to get a test.
The same level of risk would exist going out to your local grocery store. I think we all need to take the same social precautions that we have been taking for some time.
One of the reasons testing is being encouraged is to get a better infection rate for the population and identify asymptomatic carriers of the virus. So for instance, I don't have any symptoms, but I actually went and got tested at the assessment center behind me yesterday. I was promised my results in 24 hours, and it has been more than 24 hours now, and I'm still waiting for my results.